In a recent New America Foundation event, Susan Neuman, a former Assistant Secretary of Education, spoke about her new book, Changing the Odds for Children at Risk. In the book, Neuman makes the case for moving beyond a focus on helping a few children beat the odds towards implementing the circumstances and programs to help large numbers of low-income children by changing the odds. To do this, she prescribed 7 principles for effective federal programs that change the odds for children at risk. Here's Susan talking a bit more about those principles.
The 7 principles focus on evidence from existing massive evaluations that we've seen again and again occur in programs that work. One is we need to target to the children who need it the most. Evidence from the Nurse Family Practitioner Program, from Early Head Start, from many of our Avancé, Bright Beginnings, all focus on the need to target. Those children who need help the most are the ones that we need to really work and work hard with. Second is to begin early. We know that prevention is much more effective than remediation. That doesn't mean we give up on older children, but it does mean that it does get harder. And so when we talk about prevention, we need to begin early in the very years with families, helping them to support and be good parents because they want to be good parents, and helping the children get the cognitive stimulation, the attachment, social, emotional development, the kind of stimulation they need in order to thrive. The third principle is intensity. So many of our programs are visits and not real interventions. Interventions have to supplement existing practice, not supplant. In my experience as Assistant Secretary, I found many times programs are substituted for other programs. They're not intensive. And so therefore we know that those children who have problems need higher dosage of programs, more time at those programs, and more sustained activity in those programs. When we talk about intensity, we also talk about depth, not just the number of hours. Whether or not they can get as much into the program in terms of their learning during that time. We also need to focus on highly trained professionals. These are not volunteers and not aides, but highly qualified teachers who really have the training behind them in order to help children with high needs. The next principle is connection to coordinated services. We know that our children really need health services, and that so many of our children are coming to school unhealthy. They have problems, inner ear problems, they can't visually see the blackboard. Often they have dental problems that keep them out of school for many days. So we need really good coordinated services, services to other health communities and activities. We also need compensatory programs. A compensatory program recognizes that we cannot just have business as usual in our classes. We need more teachers, smaller ratios, more effort at addressing the specific needs that these children have. And finally, we need accountability. Accountability I call the linchpin of all change, because accountability helps you determine what these children need. It gives you a roadmap for determining how to run the program, and it finally begins to give you evidence of whether or not you need to change things and whether or not you need to improve them. So all of those 7 principles have again and again shown to be effective in our most well-respected programs.